Hi, my name is Doug Hannell. I'm a professor in orthopedics and sports medicine at the University of Washington. I'm affiliated with Seattle Children's Hospital, where I do hand and upper extremity surgery, and Harborview Medical Center, where I do trauma reconstruction of the upper extremity and microsurgery. Today we're going to do an examination of the upper extremity in an otherwise healthy individual. This is Levi. He's in the 9th grade here in Seattle. And so it's going to start with a very simple shoulder exam, a screening exam, that if Levi performs all of the things that I tell him to do, and it's pain-free, it's very unlikely that I'll find anything wrong with him. So Levi, can you take your shirt off for me, please?
Yep.
So, as we look at Levi, take your hands out like this. You'll see that the station of his hand, this is a valgus, it's a normal valgus. We look at his shoulder girdle, this is normal. Landmarks, they're doing great. Now for the simple part of the exam. Levi, you're going to do exactly what I tell you to do.
Okay.
Okay? Why don't you take your hand, bring it up over your head, just like this. Go like this, and go like this. Put it down by your side. Same thing with the other shoulder. The other hand, like this, and behind your back. Okay. Then put your arms down by your side again. Go like this. Press hard. Notice these guys get big. Put them down. Bring your arms up. Bring your arms down. Put your hands like this. Roll them in. Roll them out. Fingers open like this. Okay. Now, I want you to pretend like you're hammering. So again, go like this. Hard. And let's do it with the other hand. Now I want you to turn to your side here just so the camera will see. And I want you to pretend like you're throwing a spear. Okay. Same thing. And do it with the other hand. Okay. Did any of that hurt you?
No.
So, with that in mind, there's very little that's wrong with Levi, and there's very unlikely that I'll find anything wrong. But we're going to break this examination into the sections: the shoulder, the elbow, the forearm and hand, and we'll go through each of those in the next segments. We're going to do an examination specific to the cervical roots, C5, 6, 7, 8, T1. And we'll break it up into their component parts. The first, C5, we have a sensory area, the deltoid, right here. Levi, do you feel that?
Yeah.
We have a motor, the deltoid. Levi, hold that right there. Don't let me move it. I can palpate the deltoid. Put your arm down by your side. And we have a specific reflex, the biceps reflex. And I can use a reflex hammer, or in this case, I can elicit it with tapping of my fingers. That was C5. Now C6. Do we have a sensory area for C6? Yes. Make a letter 6 just like this. And this is C6. That's the sensory area. The motor for C6 is the biceps muscle. So hold it right there. And the reflex for C6 is a brachioradialis, right here. Now we'll go to C7. In C7, our sensory area is middle finger, middle finger. The motor area of C7 is the triceps. Push against me. Boom. And finger extension. Just go like that. Against resistance. Okay? And relax. Now, there is a reflex for C7, and that's the triceps tendon. So now we've gone through C5, C6, C7. C8 and T1 do not have a reflex, but they do have a sensory area. Okay? C8 sensory area is the small and the ring fingers, the forearm. Spread your fingers apart, bring them together. Finger flexors and the intrinsics. Spread your fingers apart, bring them together this way. Okay? And the same with T1. Interossei, hold it together. Relax now. Okay. And the sensory area for T1 is the inside of the arm. And that completes the neurologic examination. We're going to examine the shoulder. First of all, we look for the common landmarks. Those common landmarks consist of the trapezium, the clavicle, the spine of the scapula into the acromion. You can palpate a bony prominence right here. That's called the cornoid. We look at the definition of muscle, which is the deltoid. And I can start by just doing surface anatomy. Surface anatomy being, Levi, do you feel me right here?
Yeah.
Okay. So we've got that sensory area for C5. Now, Levi, I want you to bring your shoulder, and we're going to go into external rotation. I'm going to turn you this way. Internal rotation. Abduction. Adduction, adduction, okay? Forward flexion and extension. I put my hand on the shoulder and I feel the glide of the humerus with the scapula, the glenoid. It's smooth, nice, smooth glide. And you also notice that as I do this, there is no apprehension. There's no sense that there's instability of the shoulder, which you would see commonly in a loose shoulder or an unstable shoulder. Now, in this area, as we drop down into and head towards the elbow, there's a couple things that we can do very quickly. One is hold your arm right there. Don't let me move this. Boom. On the same token, I'm going to put your arm there and I'm going to push up. Don't let me move that. Now, I think one of the easiest things in motor examinations, which you just saw, was placing the motor in the position that you want it and having the patient hold it, as opposed to telling the patient to move it for you. We've already seen that in the first segments, and Levi, just relax now. Okay? Telling Levi to bend his elbow and extend his elbow is okay, but this is actually much quicker if you just say, hold it right there, don't let me move it. And that tests his biceps. Put your elbow right there, don't let me move it. And his resistance to me tests his triceps. Same token, if I take his shoulders and put it off to his side like this, say, don't let me move it, and doing it like that, I've tested his deltoid. Now, Levi, put your arms by your side, just on your hips, and press in. And this is a nice way to examine for pecs and for latissimus. In little babies, in newborns, if you reach inside and you're looking for the presence of a pectoralis major and latissimus, even if you squeeze up underneath there, they'll contract down and you'll be able to palpate that. And we look for that in those syndromes where there's an absence of the pectoralis major. So that's the shoulder exam. I'm going to demonstrate a part of the examination that I use in athletes, looking specifically at the stability of the collateral ligaments of the elbow. There's ways that you can test it to see if it occurs. One of those is just taking the arm and trying to bend it as we go through flexion and extension. Okay. The other is to take the arm, one over the other. We'll take this one over the other like that, and stress it. And we're looking for pain right here, which we'll see in throwing athletes. That's the ulnar collateral ligament, or the UCL ligament, and that will be painful at this point as I'm putting valgus stress against this elbow. The second is to actually turn the elbow into a knee. And we'll, again, as we go into from flexion to extension, you'll find that we're putting, in this case, putting a varus strain on the ulnar collateral, or on the radial collateral ligament side. That's a varus stress on the radial collateral ligament. And we'll also do this simultaneously while supinating, and we look for that entity that is called posterior rotatory instability of the radial head. Now those are hard tests to do. And a nice way to reinforce the fact that this is a normal examination is to have the patient do a push-up from a chair or from the side of the table. And Levi's going to demonstrate that. So Levi, come here. Sit down and just do a push-up. Let's just do it twice. Okay? Do it again. Now have a seat. I'll guarantee you that any patient that has posterolateral rotatory instability or an insufficient radial collateral ligament or an insufficient or partially torn ulnar collateral ligament won't let you do that. Or if they do that and they're very good athletes, they'll do it by putting all their pressure or offloading onto the uninjured side.
Hi, I'm Matias Sepúlveda, orthopedic surgeon from Chile, and we are here with Gabriel. He's going to show us a normal examination of the upper limb. The first thing that we do is look at the normal axis in extension. So we can see that the normal transportation angle is in a little valgus. Then when we do flexion, these tend to go into a varus direction. After that, we put our elbows next to the thorax, and then we do a little external rotation, that's supination, and then pronation. Then we see the wrist movement, we see the extension, complete extension, and flexion. And we finally can check the elbow flexion and the shoulder extension.